pediatric thrombosis is a rare disease, but this is a non-recognized condition. And it includes, we realize that it includes a lot of challenges regarding funding and regarding training during the fellowships or the residencies. Thinking about that, we created this mapping you already know regarding the thrombosis and arterial thrombosis in pediatrics. We got 55 responses from 45 centers in 12 European countries. And we got responses you can see from many different places. You can see that my friends in Spain and Italy responded from several centers, and we got all that information in this poster we shared in the last European Hematology Association Congress in Madrid this year. There is nothing new to tell about this, but I would like to highlight in this. We realized that pediatric thrombosis is not a rare disease and is not recognized in orphanet. We saw that there are some entities that have an orphan code, but there are another one that they didn't have an orphan code. So we started talking with orphanet, thanks to ERN-EuroBloodNet, and luckily we have 2 new codes, but we still don't have codes for some of these diseases. And we are still struggling with them because they say that pediatric thrombosis is mainly secondary to the use of venous and arterial central catheters. We agree with that. This is true, but they established that the secondary diseases are not included in orphanet. We disagree with this because some entities, such as heparin-induced thrombocytopenia, are included in orphanet and they have an orphan code. So we are talking with them about this in order to get these orphan codes. We think that is important for us. Apart from that, all together with Helene van Ommen from the Erasmus Sophia Center in Rotterdam, we decided to create this pediatric thrombosis working group. We call it PET working group, with the mission to ensure the best management for pediatric patients with thrombosis in European countries, and with the vision of becoming an international reference group in pediatric thrombosis to work together with other important international groups in the world. You can see here different the precedents of the participants in this core group. You can see here the names of the participants and the cities, countries, and hospitals where they come from. You can see us here. And we started talking about, okay, what areas we would like to talk about, to work about. And we thought about the gaps. We have gaps in clinical issues, in registry, and in research, also in education, but we wanted to know which areas we wanted to work in. So we, I will talk about this. We started doing this survey thinking about which topics are more relevant for us. So you can see here that thromboprophylaxis in teenagers, thromboprophylaxis in acute lymphoblastic leukemia patients, pediatrics, obviously, the thrombophilia testing in pediatrics, the use of DOACs as prophylactic treatment, and the reversal of anticoagulant treatment in children are the topics we are most interested in working. And these topics are real gaps for us. We have started, in fact, we met 2 days ago. I don't have the slides about that meeting, but we met 2 days ago, and we started talking about the thromboprophylaxis in acute lymphoblastic leukemia patients. And the first step will be to create a mapping, a new mapping regarding the use of thromboprophylaxis in this regard, because we have seen that there are many different approaches, many different chemotherapy protocols in Europe, and we want to know what is happening. So we will share with you in the future probably a new mapping, a new survey in this regard. So Vicky will have more work for sure, but we think that is a very helpful tool for us. We are also thinking about using CPMS, but actually we are thinking about doing something regarding educational actions. As you can see, we are starting this group. We have many different ideas, but we are starting step by step. And that's all. Thank you very much.